In this video, we're going to find out whether this young lady is seriously injured or has something really medically important that we need to attend to, or might she be seeking some parental attention? Hello, hi, how you guys doing?
Good, thank you.
Good. She said it was hurting?
Yeah.
And where was she pointing?
The muscles right here.
Right there. Okay, what was she doing right before she started having pain?
Well, the last week she was involved in a lot of activities.
She did have a lot of activities?
She was in summer camp. Sunday was better, but she still complaining. But today she crying a lot and she pointing right here.
Oh, really?
It's hurt me and she couldn't walk.
So she's not walking?
No, she's walking, but she's still complaining. You know,
Really?
like. I actually, can you walk, mommy? Put it now.
We got stickers over here, and they're right over here. Okay, you're walking pretty good. Do you want a Moana sticker? Yeah, which one do you want? All right. So, she's walking pretty good.
Now she's walking up. Sometimes she's doing like.
Let's put her up here. And right now we're moving the hip and looking at her face and making sure she's not like having pain. So she's doing really good, and we're twisting, and that's just good smiles. And then we'll take this hip, twist, and move. We're still smiling. So the hip is okay. And you watch the face, and that's the one thing you don't want. I'm watching her face, right? Mm-hmm. And up and down, and she's still smiling. Mm-hmm. So if you're wondering in the future, you can do that.
Okay.
Don't ask, is it hurt? Because you might say yes, but you watch.
Okay.
And clearly it's not hurting, so that's good. Then we can check the knee, which is this way. And we can check the knee for stability. I'm just trying to push here. It's good. Again, I'm watching her face and squeezing fairly hard, and she's good, right? We're not having, I'm pushing pretty hard and she's not worried about it. Now I'm gonna check this bone here. Is that okay? She says no, but she's still smiling. How about this side? No. So I'm getting the same reaction both sides.
Like
right here.
I touched her. She, I would not. Maybe it's this part of it. She said, no, it's not that part.
Yeah,
only
you
this
can
part.
get hip pain all the way referred down to the knee, but
okay.
it's not our hip because we did all those moves. You know, she might have pulled this muscle, right?
Okay.
Like what we call a sprain or a strain of a muscle or the ligaments, and it hurts. But you saw how well she walked, pretty good?
Yeah.
Yeah, so I think we're fine just to watch it. I didn't see anything that causes me to feel like we need to do an x-ray.
5 minutes she was on the floor. She didn't want to stand up.
Yeah.
Because she was complaining with pain.
Right.
She's crying. I never see her like that. So.
Have you ever had what we call a Charlie horse, where you get this, the muscle goes, and it's like, right? Could she have had something like that?
I don't know.
Yeah.
I don't know.
You ready to go? You got your purse on? So, you think you're gonna be all better now?
¿Está mejor, no?
¿Está mejor? ¿Todo está bien?
¿Te sigue doliendo?
Sí? Ok.
¿Te sigue doliendo?
¿Todo está bien?
Dime.
Sí. Okay.
Sí.
So, folks, I think we've had a spontaneous resolution of a painful thigh that probably there was some injury, but it wasn't significant enough that it's going to cause her ongoing problems. And you can always come back if things change, okay?
So what medicine I have to give her for the pain?
So for right now, nothing. But if it gets worse, I would recommend ibuprofen. Not Tylenol. So Tylenol is acetaminophen.
Okay.
And while it is a pain reliever, ibuprofen helps with inflammation better.
Okay.
And also, ibuprofen is less hard on your body. Tylenol is hard on the liver, and also it blocks glutathione, which is your detox molecule, blah, blah, blah. Dr. Paul here. I would say almost on a daily basis, when I have a full schedule, I'm gonna have a child who has symptoms that don't really represent anything serious going on. So my own kids, the guy behind the camera, when he was little, had to have Tylenol. Now, shame on me, we had chewable Tylenol that tasted like candy, and man, we got milked as parents. Yes, we did. He's thinking about looking at himself in the camera going, yep, I did.
True story.
True story. They also wanted Band-Aids. Non-stop they wanted Band-Aids, and we had to have a policy ultimately, no blood, no Band-Aids. Sounds cruel, but we were getting worked, folks. Well, as a parent, you don't want to miss something serious, and you absolutely should seek attention if you're not sure, right? So I don't want this in any way to sound like I don't care or that I'm telling you to ignore your child's symptoms. But there are some clues that you as a parent can use to determine whether or not whatever the symptom may be represents a medical condition, or is it perhaps your child is getting something in the way of parental attention. Kids love our attention. So when we respond with love and affection and attention, oh baby, or whatever that loving concern that we should have as parents, it's like to a kid, it's like, my mommy loves me or my daddy loves me, and they want that. Who wouldn't? So just to be careful, a good tip is if you start to wonder, right? Sometimes your gut instinct says, is this real or am I getting worked? Or if you're just not sure because this symptom seems to be coming on more and more and yet doesn't match any injury or just doesn't match the story, right? The symptoms seem worse than the story would make you think it should be. Try ignoring it just for, a minute or two or three. So, let me see here. This Kleenex, when I drop this, that represents the child telling me their story. So in the case you're about to see, this could be an example. Let's just say this child is having leg pains to the point where they're crying in pain. They want something for pain. They don't want to walk on it. I mean, it sounds really serious. And of course, if I as a parent, oh, baby, they feel loved, and who doesn't want parental love? But how about this response? You're only going to try this if you're wondering, and of course you're going to deal with your kid's issues. So the child has their complaint. Dropping this is the complaint. I want you to watch my massive response. So here we go. Whoa, there's cars going by outside. Oh my goodness, the forest, the sun's out. That's amazing. Now what did I just do? First of all, when the symptom arose, no change. It's as if it didn't happen. And secondly, I pivot and change the subject. So usually going to the window works great, but you just change the subject. Now, if you see your child just sort of like drops their complaint and wants to see what's going on, right? Clue, probably that symptom wasn't as significant as they were making it out to be. That's just an example. I mean, this comes up all the time, whether it's, usually it's pain somewhere, right? That's the most common thing that we can get tricked with as a parent. That being said, full disclaimer, take your child's symptoms seriously. What if it was serious, right? But parents, sometimes you just wonder. That's how you try it. That's how you test it out. Just sort of pivot, walk away, don't have any major reaction, and see what happens. And you might get your solution and save yourself a doctor's visit. Thanks for watching. I'm Dr. Paul.